And good morning, everyone. Welcome into a brand new edition of Sports Medicine Weekly on this Sunday mornings. I'm Steve Cashel, joined by my usual co-host, Dr. Brian Cole. He is the head team physician for the Chicago Bulls, one of the team physicians for the Chicago White Sox, sports medicine specialist, orthopedic surgeon at Midwest Orthopedics at Rush. Our producer is Shane Reardon. Our website is sportsmedicineweekly.com. And Dr. Cole, I want to jump right into it on this Sunday morning. The NFL still hit with COVID and game cancellations and games moving, but the big injury from the week really was Dallas Cowboys quarterback Dak Prescott with his compound fracture and dislocation of his right ankle. And my question for you is, I know we've talked about when someone suffers a torn ACL, you have told us in the past in this show that sometimes it's to wait till the swelling goes down and then do surgery a few days later. They had surgery on Dak Prescott several hours following the injury. So how does tell us about surgery for a compound fracture and dislocation of an ankle, and how that is operated on?
We have very few emergencies in orthopedics, and a compound fracture, otherwise known as an open fracture, Steve, is one of the worst emergencies that we have to deal with. And it can be a difference of, life or limb if it's not managed properly. Open fractures are associated with a very high risk of infection. They usually are associated with a high level of bone and soft tissue injury. So sometimes it's simple, where the bone has a point or something that sort of punctures the skin, and sometimes it's a very significant open area. But they have to be managed urgently, and that's not uncommon to go right to the operating room to take care of it. And sometimes we have to do it in stages. We've got to take the player, the athlete, or the patient to the operating room. We have to stabilize, reduce the joint, meaning put it back into position. And sometimes it requires pins to sort of stabilize it with something that we call an external fixator. A washout of all the soft tissue, and oftentimes you have to go back and have repeated surgeries just to get it to the point where you can safely manage the fracture. So it's one of the worst things that we deal with. This is a terrible injury, but they have an amazing medical team. I know these guys well, and they have a traumatologist who gets plugged right in, and the timing was proper. And if he ever has the opportunity to do well, he's got a medical team behind him to get him there. This could be, however, a 4 to 6 month recovery minimum.
Yeah, that was going to be a question and ask you, Dr. Cole, is, the typical, can he come back 100%? Will this be as strong as ever, maybe like you do with a torn ACL?
Yes, he can. I don't know the nature of the injury in totality, but there's no question he can come back, yes.
Okay, interesting stuff. And second question here in this segment, the Bulls have a new head coach, Billy Donovan. How does the Bulls medical staff get acquainted with Billy and get him up to date?
Yeah, so this is the first thing is Todd Campbell, our new trainer. We have Chip Schaefer, who have been involved with the medical team. Arnold and Mike, our other trainers who a lot of people know. These are, that's the first thing, is to sit down and go over the guys that we have on the roster and go over their history. And right now, over the course of the next week, there's going to be a lot of activity with the virtual combine, where players are coming in from all over the country to various places within their home region. Because we're not doing the combine in one location, we're seeing players in our office who we may not have an interest in, but others may. So we're doing our physicals in a virtual way and the medical evaluations in a virtual way. So I'm going to have to sit down with Billy and the new coaches and so forth in the very near term as we approach the draft, because after we get done with the physicals over the next 2 weeks, we've got to sit down and score people and figure out who might actually fall into the fourth position I think we have, and then I think we might even have a second round draft pick as well. So it's a pretty complex process, and this doesn't make it any easier right now with COVID. But we'll have some face-to-face meetings in a physically distanced way and keep it safe.
Okay, terrific. Well, let's move on.